Hi, everyone. Welcome back to the Health Tech Edge. I'm Mike Moore. On this show, we keep it practical: what problems are showing up in healthcare operations right now and how teams are actually fixing them. Today, I'm joined by Aqeel Shahid, SVP of Channels and Alliances at IntelePeer. IntelePeer works across industries, but they're doing some meaningful work in healthcare, especially around patient communications. We're going to talk about three problems every health system and large practice is dealing with, like unanswered calls and access issues, appointments, no shows, and wait lists, and patient billing and collections. And the through line here is simple: staff are overloaded, patients still rely on the phone more than we think, and AI can remove a lot of friction from these workflows while keeping humans in control. Akil, great to have you here.
Mike, thanks for having me. Pleasure to be here.
All right, sounds good. So let's get into a little bit of background here just to help folks. So, if they're not familiar with IntelePeer, what do you do for healthcare organizations, just in plain terms?
Yeah, so Mike, what IntelePeer really does is we help healthcare organizations automate the patient interactions using conversational and agentic AI. And what that really means is answering every call, managing scheduling, sending reminders, handling billing inquiries 24/7. And we use that, and we do that across all the different mediums that a patient may use, right? Whether it's voice or SMS or chat. So we leverage all the different mediums accordingly. And obviously what that results in is fewer missed calls, fewer no-shows, faster payments, happier patients. And all of this happens, in a way that feels natural and human, not robotic.
Yeah, and I think that a lot of you're a telecom industry guy for a long time, right? I just know from your background you've been doing this for a long time, and there's a lot of
Yeah.
technology that's been deployed and interactive voice response and all of this, but the generational shift that's happened now has been the introduction of AI into these call experiences, right? Can you talk a little bit about kind of what it was like a few years ago and what the transformation has been like into this more AI based conversation environment?
Yeah, 100%, absolutely. I mean, obviously, the industry has evolved so rapidly over the last few years, and it's even just in the last year or so, the technology has come a long way, right? So the three big shifts that we're seeing that has made this technology so useful is that the advances that has happened specifically in conversational AI today, it feels more human. It's not as scripted, it's not as robotic as I mentioned earlier. So that makes it more acceptable, easier to adopt by the end users. You're not necessarily reverting back to what normally they would do, which is, scream for an operator, right? So that obviously is one of the biggest advances that has happened. The other thing is the maturity that has happened in the industry around the integrations with the key applications and EMRs, patient management systems that are now available, which now make it easier to integrate and incorporate that in the workflows and make it more seamless for the patient, for the providers as well, right? And then the compliance and trust frameworks, which is the third element, that, with high trust and HIPAA and ISO certifications, right, have now given the comfort for healthcare organizations and leaders to adopt the AI confidently, knowing that it meets all the requirements from a compliance perspective as well. So combining all those aspects with the rising patient expectations for 24/7 access, and AI again is no longer a nice to have, it's an essential aspect. All those things combined has really now brought this evolution to the front of almost every organization right now, and that's really what's leading the change.
Yeah, I have to imagine too that over the years, with all the different generations of technology and designing phone trees and all the thought and planning that went into what the options should be, and press one for this and two for that. And now I would think a bit of that goes out the window
Exactly.
because the agent's smart enough to listen, and you can say, you don't have to, as you say, like, people screaming at the phone, like there's videos, right? Of like, operator, operator, just like trying to get to someone human. Now it's like I might be okay not speaking to a human because
Exactly.
I can say whatever is on my mind and get the help that I need without having to fit into whatever format someone's designed a phone tree, right?
Exactly. 100%.
So I think the opportunity here, thinking about the volume of phone calls as you've done these type of implementations with some of your healthcare customers, what is the process that they use, when they're talking to IntelePeer and saying, we want to do this, like we think there's an opportunity to use AI to help with our phone. What is the approach that you take with them, and how do they approach it, so you figure out where to go first? Like, where are their quick wins in this, I guess, is a quicker way to say that.
Yeah, I think that the big thing that we do obviously is really get with the providers and the healthcare practices to understand some of their key pain points. What we're seeing typically in most healthcare organizations, there are a couple of low hanging fruit are common challenges that they're all facing with, right? Which is usually, like I mentioned earlier, appointment scheduling, which basically goes to, I want to schedule an appointment, I want to change an appointment, I want to cancel an appointment, all those things associated with that, right? The other big element we see along the fact is, prescription refills. We're seeing, folks trying to juggle, aspects with collections, right? So we know that those, based on how long we've been doing this, they tend to be the universal problem that are being faced by healthcare organizations. So what we do is we sit down and we really identify the challenges that they're facing and ensure that that really is what they are also facing with. We do also with working with them an intent study, so we understand what specifically are patients saying when they're calling in, how long are they sitting on hold, what are some of their key pain points that they're experiencing, what are some of the responses that are coming back to them. So really kind of putting together this whole study based on the analytics that we'll gather gives us, the proof points that we need to go work towards, right? So we know, okay, well, here is what the potential ROI could be, because 80% of the calls that are coming into an organization tend to be for scheduling. And by just automating that aspect, we know we could help, alleviate the challenges that the front desk staff is being faced with, give them the additional time to go focus on patient care and other administrative tasks versus having to sit on phones and trying to answer those common questions that are coming in all the time. So that's kind of the methodology we'll use, and we are very hands on through the implementation process as well. So we're not essentially prescribing a solution and walking away. We stay very closely involved. We are basically designing, implementing, configuring stuff with the actual user the entire time, all the way through implementation, and then fine tuning the solution along the way too, because we know it's not a set and forget it.
I like the idea there that you're capturing some of the existing metrics around call volume and length of calls and those kind of attributes, because you can't, if you don't take that snapshot before you do the implementation, you won't be able to measure the success or the impact that it's having on their organization and how things work. So I think that's a really insightful point there that I'm sure the customers appreciate too, because ultimately someone wrote a check for this and they want to be able to show that this project was successful and
Yeah.
useful. And if you have to get those metrics in, right, that's a key piece of it. I wonder what your thoughts are about the human impact of this. There are people who, depending on the organization size and type, they may be sitting in a contact center where they take these calls, and that's a group of people. So, there's a human aspect of AI that we worry about with, humans being displaced. So let me stop there and just kind of ask, what's the reaction in terms of the human impact and kind of displacing workers and those things, and how are you and your customers talking about it?
Yeah, well, that's a great question, and certainly one that's a top of mind, Mike, for a lot of folks out there, right? As they're looking at deploying AI type solutions. I mean, it's not the solution. Obviously, isn't meant to replace any humans, right? It's there to help augment and take those mundane tasks that these maybe call center workers, front desk administrative staff workers, or in some case even the healthcare practices, workers are faced with, and really moving those mundane tasks off their plate and allowing them to focus on the core element. So it becomes more as a, and you've probably heard this term used a lot, becomes a co-pilot, right? It's really there to help work alongside them, to help support them so that they can do their tasks better and then move this stuff off the plate. So really that's the element of conversation that we're having, is that, look, this is not meant to replace any of the human element. It'll do the basic stuff. And then there are things that, you get to a point where it cannot help solve. So it then escalates, gathers the core information from the patient, and then escalates the call to a live human to take the more complicated questions that are being asked, right? Like, hey, is this medication going to interact with my other medication? Or, what do I do? And those kind of interactions can now be sent to a nurse with context, or sent to somebody with context, so they know exactly what that person is calling in for, and allowing them both to be more efficient. So the patient doesn't have to sit on hold, waiting for a long time. And the provider doesn't have to, you have to, answer those basic questions that basically tie them down from taking care of the more complicated questions that a patient may be asking.
Yeah, I think in healthcare, especially these conversations that I've been having on the podcast this year, we talk about helping clinicians operate at the top of their license. There's administrative tasks that everybody gets bogged down with as part of their jobs, but if we can help clinicians, oftentimes these are administrative professionals or contact center
Right.
professionals, customer experience, customer support. But I think what I take away from your last answer there is it's much the same. We want to help them operate at the top of their capabilities and automate for them and also for the patients
Correct.
and the members, right, and their families and caregivers and people who are helping to coordinate care. It's taking care of some of those mundane tasks that don't need to necessarily be done by a human so that the humans now have more time that they can focus on applying their time to those more complex things. And we've all been at the doctor's office when you're waiting to check out or waiting to check in or waiting for something in front of a desk when the person is on the phone and they're on
Exactly.
the phone and they're on the phone. It's like, so if someone is wearing multiple hats where they're trying to deal with the person in front of them as well as the person on the phone, if we can give them some of their time back they would have spent on the phone through this automation with AI, it's a savings for everyone involved, right? There's at least three parties involved in that kind of
Absolutely.
scenario. So I think
Absolutely.
also one of the things that I like about what we've been exploring and I mentioned in the opening is the whole thing around no shows and wait lists, right? Like if you've ever had a call from your doctor's office
Hmm.
reminding you of an appointment and it was a human, even now, like I think like, why is a human calling me? Like this could have been an AI agent or something, or even the previous generation of technology, press one to confirm, but now an AI agent can help. And then obviously we're not as constrained as we are with the person who only has a couple of minutes to make those phone calls, right? So can you talk a little bit about the no-shows and waitlist management and kind of how
Right.
that scenario is playing out with your customers?
Yeah, no, 100%. I mean, for most healthcare practices, obviously, the no-shows and wait and is a big element, right? That is how, if they don't have patients coming in, it's wasted time with the doctor. Yeah, they don't have butts and seats, and that obviously impacts, their revenue as well. So, how the system basically, it can be set up, and as you mentioned, right, it not only can it make a proactive, call out to the patient, reminding them of an appointment, but giving them real time capabilities to actually reschedule right there. So it's no longer, hey, you have an appointment coming up. It's not just a reminder. It's more like, hey, you have an appointment coming up, Akil. Is are you still able to make it? And I can conversationally tell the system, yes, I can make it, or no, actually, in fact, I need to be on a flight and I need to go someplace else. Can I reschedule? Great, absolutely, I can help you with that, and you can go ahead and now immediately reschedule me for another meeting, so I don't have to now cancel the meeting, cancel that appointment, then call back and sit on hold and talk to a nurse again to get it rescheduled. So it's definitely painful for the patient. And also now you have a no-show, right? And the other thing that the system now is also able to do is it's able to proactively, do a wait list of patients that may be waiting to see the doctor. And it can now recognize, going, okay, well, so I see Akil has canceled, but Mike now was also waiting to see Dr. Joe. So let me go ahead and call Mike and go, hey, Mike, we have a cancellation at 1 p.m. Would you be interested in coming? And now it goes ahead and schedules you instead of me, right? And so what we've seen is that, by doing that, we've been able to reduce no shows by up to 25% and keep schedules full by fulfilling cancellations quickly by just doing just that basic task that we just talked about. And again, it's all done in a conversational manner. So no push one for this or say one for this. It just happens like you're talking to another live human.
Yeah, I love the certainly the aspect of kind of reminding people and different people, I'm sure that they have the ability to express communication preferences when they want a phone call versus a text message versus a notification in their Epic My Chart app and those kind of things. But the notion that while we're on the
Right.
phone and I'm changing my appointment, that just became free in the schedule. And I say it like another agent, like it's another human. It's obviously not, but another agent could be calling out to you to offer that same time slot that just became available
Yeah.
because you were waiting to see the doctor. And so the multitasking nature of this and kind of
Yeah.
how things can move very quickly and the efficiency that that brings to the practice, again, I think capturing all the metrics around that must really be exciting for you and for your customers because there's a whole new opportunity that was really hard to react and be that dynamic before. But now with the automation, AI can really fill in the blanks literally.
Yeah. 100%. Absolutely.
So let's talk about another scenario here, which is the one we've touched a little bit upon is kind of around the patient billing and receivables. Now, we talk about personally identifiable information and personal health information, obviously, as being sensitive. Financial data is very sensitive as well, right? Calling and giving
Yeah.
someone your credit card number over the phone to pay a balance or something. How do you look at the whole scenario around billing and kind of the calls related to that? And you talked about some of the security certifications, those kind of things, but just walk us through a bit around this and how you protect the financial piece of it and what kind of results you're typically generating.
Yeah, no, that's a good question. And when you talk about billing, right, that's another key element when you look at where a lot of the healthcare administrative folks spend time on is really calling to collect on outstanding bills, folks that came in, and have the copays that have not, made the copays that have outstanding amounts that they have not paid for. Again, that requires a live person to make those outbound calls. And so we've been able to automate that entire, experience as well, where now you have an AI agent that's basically calling out on behalf of that practice, reaching out to a patient and collecting on behalf of the practice as well. And so in order to prevent the sensitivity aspect of it is when we reach out to a specific individual, we'll authenticate that person on by asking them a couple of key elements such as date of birth or other aspects that the practice needs to ask to authenticate that end user to make sure they are who they say they are. And once we've authenticated that, then basically give them an option to go ahead and make the payment. And our AI handles billing inquiries and can send empathetic payment reminders. But it's because it's not a live human, we've seen a 30% improvement in collections on overdue balances, right? And again, that doesn't require a live person to be added there, and you don't need to have a person making those outbound calls. People are more likely to make a payment to a virtual agent, an AI agent, than a live person. I guess I guess it's a sense of not getting embarrassed because I owe money, and they can also have a conversation with the AI agent where they can basically come up with options if they can't pay the entire amount. Meaning they can go, can I pay this in multiple different payments instead? Can I come up with some kind of a payment plan of some sort, right? And so once we do that, any kind of information that the patient is sharing as far as credit card information, we are, PCI compliant as well, we redact all that information, right? So that credit card information that they're basically sharing, we connect directly to all the merchant processing, applications, and we'll literally the information goes directly into the merchant processing application for payment. We get the information back that says yes, the payment's been received, but all that information is redacted so that none of the information is stored on our end, and it keeps everything compliant from that perspective as well.
Yeah, that's great. I think, for people to have confidence in AI and all the various ways that they're exposed to AI, those kind of safeguards being in place so they know that if they're sharing that information, it's not going to be, just sitting in kind of a plain text file somewhere in the organization systems or sitting in their My Chart, all of a sudden you stumble across your credit card. It's like, they want to make sure that their information is
Right.
protected. But I do think one scenario too, and this there's a study that we saw a few weeks ago that was published by the American Heart Association that was done by a clinician at Emory uh, in Atlanta, and they were looking at care gap around taking blood pressure readings, and they had a phone agent call out and remind people that they were supposed to be recording that, and if they didn't know how to do it, it would walk them through it. And the AI agent, of course, has something that you and I have in limited supply, which is patience, right? Like the ability to kind of like sit on the
Right.
phone and talk. Like if you've ever provided tech support to your parents, this is like there's a breaking point we know as humans, right? We can only, but I think that's where AI also can excel, right? Is that it
Yeah,
can
like
be patient and explain things and repeat instructions and wait for, if
correct.
my mother needs to go to the other room to get her wallet because that's where the credit card is that she needs to do the payment or whatever it happens to be. AI has levels of patience that humans are potentially
Exactly.
capable of, but don't exercise well. So I have to imagine that that's like from a patient satisfaction point of view. Do you get survey data around this or to your customers, and what's the feedback been?
Yeah, no, you're absolutely correct. I mean, we do get survey data that they can actually provide responses on how well the AI agent has done. And we've seen almost every time, they like the fact that the AI agent doesn't have emotion in the conversation. It's consistent every time you call it. It doesn't have a bad day. So it's gonna basically provide the responses, in a fashion that is conducive to what the patient is looking for. And again, it is intelligent enough to realize when a patient is getting heated or the person, the caller is getting heated to where it needs to now escalate the call to a live person because it is at that point where it needs to go. but simple things like in the previous example of just collections itself, right? It can provide a simple explanation. It can basically handle the frontline questions. It can basically walk them through the component of why do I need to pay a bill? Well, let me explain to you, and it can walk through a methodical process without the emotion aspect of here's why you need to pay the bill. And also, it does have some element of empathy that can be configured in there, the way where it will acknowledge and recognize. I understand you're frustrated. Let me help you. Let me get you to live persons. There's things it could do to really help. And again, depending on the population, you mentioned obviously an aging parent as well, right? If you're working with an older population, being able to slow down the pace at which it speaks and how it basically, responds versus, talking to somebody else that, you could speak at a faster pace as well and be able to handle accordingly. So it does adjust, and it does have the ability to triage and do those things accordingly.
Yeah, that's great. It just made me think too about when you're talking about the speed of speech and, different people move at different speeds, right? So it's speaking too fast, slow it down, that, speak faster. Maybe somebody is going to say that. But what about multilingual? I have
Yeah.
to imagine that that's a scenario that a lot of practices struggle with because, here in the United States, very diverse populations, depending on which markets you're in, they may have a variety of languages that how do people cross the language barrier as they deal with these type of agentic systems?
Yeah, no, again, you're right. There's a lot of different, dialects that are also being used sometimes, even in the U.S., right? Depending on where you're calling. If you're calling in the South, they have a different dialect on what and how they say certain things versus somebody on the West Coast or East Coast. So really, what we do, obviously, that's part of the analysis that I mentioned earlier that we do is really sit down and understand exactly what's going on. I mean, a good AI system should be conversational and fully customizable to match practices, tone, and brand voice, right? It uses natural language, the empathy driven scripts, specialty specific workflows, so the patients feel like they're talking to a helpful assistant, not a bot, right? And so what we do is, in the case where they have multilingual patients calling in, we could identify exactly which languages that typically the patients are calling in for, and depending on the languages that they're speaking, be able to converse with them in that specific language. And we support up to 40 different languages that the system can actually have a full-on conversation with the actual caller calling in as well. So if they're calling in and they want to speak in Spanish, well, the system will then respond to them and ask them questions and interact with them in Spanish and be able to do the entire interaction with them in that language of choice as well. So it is, and again, like I said, it is something that it's all fully configurable depending on the population of the patient that specific practice may be handling.
Yeah, which is amazing. I think I heard a statistic years ago that something like 90% of the world speaks, 9 or 10 languages, right? So if you're at 40 for what you're supporting in your product, you're probably covering, a good portion of those folks, which I think is important too, because quite frankly, we could be speaking English to a
Correct.
doctor, especially you get into some of the specialty practices and not understand half of what they're saying because they speak in all the medical jargon, that's associated with the industry, right? And, sometimes I
Exactly.
need ChatGPT just to translate when I'm helping
Exactly.
my mother with her appointments sometimes and understanding doctor's feedback. So, there's the jargon in English and then obviously you start, trying to translate. But I think what's
Yeah.
amazing is not having to schedule or call into a translation service that's going to have a human translator. And so there's an expense aspect of that, practices pay for today in some of those settings. So how
That's
nice to
right.
be able to support their patients in a variety of
Yeah.
languages, speak the language that's most comfortable for you, and we're going to be able to help you and get stuff done. So that's amazing. So my last
Exactly.
question for you, Akil, is where do you think we go from here, right? There's been an exciting, I think ChatGPT, as we record this here, we're at the end of 2025. I think ChatGPT just had its third birthday about a week or two ago. Where do you think things are going to go with this technology over the next couple of years, and how this shapes the customer, patient, member experience in healthcare?
Great question, Mike. Obviously, as I mentioned earlier, the technology is evolving so rapidly. As more consumers are getting comfortable using AI in their day-to-day lives, you're one. Obviously, it's learning quicker, faster, and it's set of intelligence is growing very quickly. So you'll just see AI becoming more mainstream, getting more involved in what we do. The conversations are going to get better. They're going to become even more human-like with other aspects such as empathy becoming even higher than it is right now. And so you'll see that evolution happen. At least where we're seeing the industry go right now is the evolution from just from being involved in the front end where it's involved in the administrative tasks to being now evolving, and it already is now, it's starting to evolve into the provider side of the house where it's sitting, side by side with a physician in a room, scribing the conversation that the patient's having with the physician, being able to basically provide next best actions to the physician of, maybe tests they should be ordering or potential prescriptions that they should be basically prescribing for that patient based on the symptoms that the patient is talking about, being able to keep a full 360 view of that entire patient journey from when they first walk in the door to their interaction with the physician, to tests that were done, to prescriptions that were basically ordered, and so on and so forth. So you see that that's the evolution of where AI is going to become even more engaged and embedded. Again, the more the consumption happens, the faster we're going to get there.
Yeah, which is amazing. This is it's almost like a memory layer that wraps around everything, that every interaction that that patient has with the medical practice, right? That, from the in the room with the doctor or the medical assistant or the nurse, through their online, their phone calls, like
Exactly.
all those interactions, to have a memory layer that actually brings it all together is really an amazing opportunity. So, all right, well, we'll go ahead and wrap this up, Akil. This was great. You kept things grounded, talking about some real problems, the real results that the practices are getting. So, I think that's really helpful. And thinking about missed calls, no shows, billing confusion, all the things that just drain an office every day, and the people who are trying to get answers as they're calling in. It's nice to know that AI can help take some of the pressure off and really improve the patient experience. So we'll go ahead and put notes to IntelePeer's website in the show notes and include that for people who want to reach out and connect with you and the company. So thank you so much for being here today.
Yeah, no, absolutely. Yeah, they can go to our website. That's the best place for them to go get access to case studies, resources, and details on our healthcare solutions. IntelePeer.ai. That's the best resource for everyone.
That's great. Well, thanks. And for everyone listening, thanks for spending time with us. If you found this useful today, share it with someone on your team. And we'll be back next time for another conversation on what's working in healthcare and health tech. This is Mike Moore. Thanks for joining the Health Tech Edge.